Once we feel it, we change our strokes. Gentle traction. Continue with the other side from the ankle, right around the ball. And then soft tissue here in the gap. Just adding more lotion here and moving up around the heel, center, and to the pinky toe. Spreading the lotion nice and wide. Two hands alternating. 1, 2, 1, 2, 1, 2. Applying a bit more pressure, focusing on the tissue under the inner ankle, right here. Pressing with the finger and moving round circular motions and straight, and again round, straight, moving more central, round motion, straight and back, round, straight, back. Right in the middle of the inner portion of the foot. Here. Bending my finger, pressing, gliding, bending and pressing, gliding, soothing. Flash. Applying more pressure to the center of the foot. Both hands that we use. Soothing from the heel, pressing, moving to the center, and again returning. Okay. Now pressing around the base of the big toe, right here. Moving the joint, mobilizing. pulling the tool, applying some traction. And returning. Taking my tool, using that hook-shaped surface, releasing the connective tissue. Moving from the heel up to the big toe. Nicely gliding over the joint. No pressure is used. Just below and above. Soothing the tissue, giving a little pull to the toe. Relax. Moving through the midline, up, up all the way to the toes, and down. Same motion, feeling for the line here, connective tissue line, and pressing on both sides, moving down, feeling it next to the heel, and up. And the outer part, using my gua sha tool with that nice incision going up. Again, feeling for the connective tissue release. And up again, checking the tissue, helping ourselves with the left hand, applying a bit more pressure. Moving up, just below the joint. Soothing the tissue, up and down, 1, 2, up, 3, down, 1, 2, up, 3, down, compression, start compressing almost from the heel. Now we're supporting with the right hand, compressing with the left. Still feels it's not released completely. Getting our acupressure stick and pressing with the stick. 2, 1, 2, 1, 2. 1, 2, 1, 2. moving close to the toes and just going across the foot right at our transverse arch, which is here. Adding more lotion. Spreading it. Getting a bit to the toes. And pressing. Now our fingers going opposite direction. Left to right. And reverse. Switching the fingers, one is up, one is down, switch, the other one is up and down. Increasing the pressure and feeling for each toe. First, big one, pressing and applying some traction, supporting at the base, flexing, extending, flexing, extending. Making sure the joint is moving. Second toe. Space between the toes, hooking my finger. Gentle pressure. And applying pressure with the acupressure stick. Opening the space, pressing in the web space. And moving to the second one. Base of the toe. Little traction, pressing on the base, and again, pressing and releasing, hooking the finger, second web space, flexing, extending, flexing, extending all the phalanx. All the phalanges get treated. Placing the stick, applying some pressure from here, opening the web space and soothing. Moving to the next web space, the third one. Little traction. Both sides of the web space. Hooking the fingers. Traction. Flexing and extending. Flexing, extending, traction. And again using my acupressure stick, pressing here and releasing. soothing the space and the toe. And the last, fourth interdigital space. First hooking the finger, feeling for all the phalanges of the pinky toe, pressing on both sides, using my stick, precise pressure, opening the web space, placing my two fingers in, giving a bit of sideways deviation to the pinky toe, massaging both sides, little traction, and release, soothing the tissue and pressing more on the outer side. Moving and feeling the toes moving against the metatarsal bone, which is right here. Pressing on the bone, muscles, and moving the toe and release. Nice and circular motions, supporting the toe, going up, and again, and up all the way to the top pinky, down once, and up again, and soothing the whole foot, nice and slow. Medium pressure. Up, down, up, down, distal, proximal, both directions. And alternating hands. Spiral motion. And the other side. Stretch it a bit. Nice and mobile tissue. And soup. One, two, three. And again. 1, 2, 3. Relax. Up, down, up. back and press. Effleurage. Nice and round movements. Applying the lotion to the inner side. Around the ankle. Starting from the heel. Onto the ankle, to the heel. Mid part. Moving to the big toe. Supporting ourselves with the left hand. Just going thoroughly, applying the lotions to the inner part of the foot. Back to the ankle. And the midline. 1, 2, 3. Return to the middle. Inner part and medium. Right in the middle. Applying lotion on the outer side. The pinky toe side. On the ankle. Now it's outer side, right here. Now we are treating the right foot. Applying lotion. Nice and light strokes. From the ankle through the plantar surface, top and bottom of the midfoot, and up all the way to the toes. One hand is at the bottom, one on top, squeeze. Okay. Now the outside. Applying lotion. One hand at the bottom, one on top. Same time. 1, 2, 3, and 4. 1, 2, 3, and 4. And now one of my hands is on inner side, the other one goes on the outer side, and we're just moving from the heel and up. One on the heel, going up, and 2, and 3, and again 1, and 2. And the third stroke, 3, moving around on the plantar surface, adding more lotion, and going across. 1, 2, 3, across from the heel and gradually going up through the midfoot. Crossing the fingers, going up, pressing on the skin, feeling the soft tissue, still going across, and the base of the toes right here. Crossing, 1, 2, pressing, releasing, 1, 2, getting close to the toes, nice and broad movements, spreading the lotion. Making sure it's evenly applied. The tissue is getting warm. Starting from the heel, applying some pressure with my left hand. Right one is supporting. Starting from the inner side, going a bit up to the space between the tendon and the bone. Applying nice pressure. Still feeling tension. Putting my acupressure tool and pressing first with the bigger part. Holding it here, stretching, and switching to the pointy one. Moving a bit around, releasing and pressing. Using my tool to go in a surface, nice and gentle, pressing more towards the heel. 1, 2, 3, 4. From the midfoot to the heel, both staying on the inner surface. And soothing the tissue. Feeling warm and soft. Massaging under the bone here. Soft tissue right under this bone part, navicular tuberosity. Moving down to the bottom, pressing, releasing, again pressing, stretching a bit, and releasing. Quite hard tissue, going with our palms, alternating, compressing, stretch, alternation, compression, stretching, and once again. Repeating it. More of a circular motion. Continue with the circular movements, switching the thumbs down and up. Finger, tips of my fingers pressing. Right hand is stretching, releasing, going down, thumb, fingers, thumb, fingers. That's how they change each other. Okay, pressing down with the thumb, pressing up with fingers, down thumb, fingers, thumb and fingers, thumb up, fingers down, thumb up, fingers down, and switching the directions, thumb down, fingers up. Feel how mobile the tissue is, and moving up. Here we need more compression. Pressing and rolling all the way to the big toe. Soothing, checking for the tissue. Need a bit more compression here. Adding it. Compressing from both sides and releasing. Compressing, releasing. Stretching. Pushing all the way to the joint. Feeling how the tissue moving. Up, down. Using again our hook. Holding foot with the big toe. And switching to my gua sha. Turning upside down. And down. So the tissue up, down, and again up and down. Move into the midfoot. Again, we feel for the line here. Our plantar connective tissue. Here's the line of the tendons. Nice central line. Going along. 1, 2. From the heel to the toe. 3, 4, 5, 6. Stretch the torus. 7, round motion. Down, round. Moving with the fingers. And down. And again. Big gauche tool and helping the tissues in the foot. Down and up. And down. Up. And down. In the tissues, nice and broad strokes, and moving to the outer side of the foot. There's one hook in my thumb, going up, relax up, relax up, and relax. And here comes handy my metal tool. Hooking and going up. 1, 2, 3, 4. 1, 2, 3, 4. And again, soothing the tissues and pressing with my fingers. First, keeping the pinky toe loose, gently supporting it, and start extending, feeling the muscle in the bone getting more mobile, pressing, moving up, and higher, and release, press, move up, and release, press, move up, and release. Some broad stroke, going for the base of the pinky. Pressing and moving, going into the web space, gentle sideway motion, traction, flexing and extending, pressing on the phalanx, and using my tool, applying the pressure right at the base. Moving the pinky toe, pressing once again, pushing between, mobilizing, relax, push, spreading, relax. Going for the first rib space, push, relax, and back, push, relax, push, relax, and the last, push, relax, going through every 5 lines, 1, do the toe, pinky toe, traction, relax. The 4th one, traction, relax. Next one, middle one, traction, and relax. The 2nd, longest one, pulling it up, traction, going against the line, along the line, gentle traction, and relax. And the biggest first line, 2, 1, 2, 1, 2, all the way from the heel to the base of the toe, moving along to the toe as well. 1, 2, 1, 2, and cross around movements, up, still staying on the first line, gentle pull, moving the joint, and soothing. And effleuration the foot after the treatment. Slow, broad strokes. From the heel to the toe. No pressure on the way back. Gently pushing it up. And alternating my hands. 1, 2, 1, 2, 1, 2, 1, 2. Feeling all the bones. Pushing up. And gentle pull. Going up. And again. Moving the toes, separating them for the last time, stretching, hooking, moving my left hand hand. And calming the tissues down. Brushing the bottom of the ankle and the foot. Spreading the lotion on both sides. Pressing around the tendon. Lifting the tissue up. And again, up. Here's the softest part. Making this part as soft as the previous. Pushing the tissue up. Feeling how mobile it's here. Making it mobile more distant. 1, 2, 3, 4. 2, 3, 4. Moving it all up. Releasing up. Up and release. Here. And fresh. That's where the tendon attaches. It's going around. Compressing. Going around one way. My right hand is going clockwise. Switching the direction. Now my right hand is moving counterclockwise. And the left is just helping. Turning it upside down. Pressing. From the attachment of the tendon down to the end of the heel, right here. Wide and narrow, wide and pointy. And pointy, again wide, point, holding with the left hand, using my thumb, across and around. down, up, down, down. Outer side, right in the middle, and again, and the inner side, middle, and the outer side. Using my second hand, thumb, pressing across, the base of the heel, right here. Two, and switching. Pressing down, up. 1, 2, 2, 1, 2, 1, down, up, and again. 2, 1, up, down, and switch. Narrow pressure from the base to the heel. Go right to the heel. And the next line. Fingers almost together, my thumbs moving next to each other, down, next to each other, down, helping each other, down, and here. Down, moving up, circle of motion, pressure, pressing, returning, pressing, returning, pressing from the return, all the way down, return. Both hands going down and going up. Going up, feeling the heel, going down. Going up, going down. Again, up. Tissues getting softer and going down. Push. Hooking my finger. Up and down. fifth bone here. 2, 1, 2, and pressing and moving it around. 4 fingers, 1 finger. Going along, alternating, down and up. Using my gua sha tool. Down. Toes. And again down. Switching to the smaller side and nicely treating each joint here. 2, 3, 4, and 5. Feeling with my hands, pushing. 1, 2, 3, pushing. 1, 2, 3, pushing. 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, going across. And pressing with 2 fingers. Next space. And again. And the next one. And soothe. First. Second. Push. Down. Third. Down. And the last one. Down. Using the other part of my tool. Moving along, push, release, push, back, push, back, returning my tool, using my hands, going back to the heel, wide and narrow. Fingers on the side, fingers together, side, together, side, together. Always returning to this point, side, together, moving narrow, together, last one, bringing them together. Compressing and releasing the tissue, compressing, moving, compressing, releasing. Bit different with the fifth one, compressing with both sides. One is the plantar side, the other one is the top side, the bottom surface and the top. Nice compression between two of them, moving up. Within the tissues, looking, compressing and moving the bone. You can see how mobile our pinky toe is. Going down, push, back, down. Push and back, going down, push, back. Chasing ourselves with thoughts. 1, 2, 1, 2, 1, 2, and 2 together. And again. Parallel. Down. Up. Down. Alternating, going downwards and up. Switch. Going down and up. Down and up, down and up. Push. One by one. Pressing on toes. Pinky one. Fourth one, middle one. You can see how the color changes. Second one, and the big toe. Spreading them apart, except the middle one. 1, 2, hyperstanding 3, 4, 1, 2, 3, 4, brushing the left foot. Lotion. Nice and smooth. One hand moving after another. From the ankle through the heel to the bottom, all the way to the toes. 1, 2, and gliding down, almost no pressure. Same time feeling for the tissues, temperature, softness. Any parts which are not moving, like here, tightness, down, spreading the lotion and turning my hands over. Down with my palms open. Pressing, moving in and out, in, out, in, out. Little bit around the ankle and the heel, around the heel, push and return, push and return, press, push and return, and again. Pressing inner side, outer side, inner side, outer side, and focusing on the heel of the left foot, right foot, going around. Pressing. And get into the center of the heel, narrowing down our strokes. Compress. And relax. Again. Push. Compress. Relax. Stop all the way from angle. Push. Compress. Relax. Pressing on center of the heel. Using my acupressure stick, supporting myself with the left hand, pressing, pressing more, and removing, settling down, and using this part, going around. Gliding it from out to the inner side. 1, 2, first direction. 1, 2, 2, and from the midfoot up. 1, 2, 1, 2, and again, and a couple of more. Using our hand again. Both hands up, down, sliding around the heel. Moving up with one hand, holding, stabilizing the foot with the other. Small circular motion from the ball of the foot up like this, pressing and moving up. Down, pressing. Moving up to the heel, holding on this side, moving down, holding, pressing, moving down, again. Pressing, supporting, different pressure, down, circular motion, all along the muscle here. Holding the ball with my palm, pressing, returning, pressing, returning, pressing, returning, right between the balls, up, down, gradually climbing up. Up to the heel and down, going up, and down, going up, and motion between the first and second toe. Pushing using the thumb, holding the ball here, moving it close and away, close and away, going downwards. Push down, second line, doing triangular motion with my thumb, Z shape, down, starting from the interdigital space to get white, next one. Small, big, down, part, down, part, together, pressing the fifth one, pinky toe line, 1, 2, apart, hands apart, hands close, close, pressing in interdigital space, holding my thumb on the side, moving them together, pressing. Using my index finger, come closer, push, release, release. Applying 3-finger pressure, stabilizing the foot. Moving towards the pinky, pressing, moving up, and repeating, moving down, a little bit more, pressing, release, soothing, moving down, pressing, releasing, pressing, releasing, down and up, using my acupressure tool, going to the same spaces, up, up, and again, then going with my thumb, soothing the tissue, the next space, 3, 4, soothing down with my thumb. More sensitive, so I'm using the other end of the stick. 1, 2, 3, 4. Soothing down with my thumb and fingers. Gentle pressure. Up. Down, up, up, and soothing. Pushing next to the toes, going midfoot, up, pushing next to the toe, up, next one, base of the toe, up, sliding down, last space, and up, going across and around, switching, pushing, moving back, switching, using my 7 fingers, proving the arch, pushing, soothing, push, soothing, push, soothing, push, soothing, down, apart, 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 down, apart. Feeling my thumb on the heel. Moving towards. 2, 2, crossing my fingers. Just like this, pressing in the midline. Apart, cross, and apart, cross, and apart. 2 fingers technique. Pressing, press, moving, pressing, moving, pressing, moving. Next one, press up, pressing, moving, down and up, press, moving, pressing, moving, pressing, moving, down, gliding, going up, compression, gliding, going up. Glided compression. Feeling for the deep tissues. Down, up, down, up, down, up. Up. Shifting the tissue across and diagonal. Stretching. Using the tool. Pushing it down, up, down, and up. Turning it the other way. Down, up, going down, and up, down, up, down, and up. With my thumb, I'm releasing whatever is left, like the tightness here. Going up, pressing, down, pressing, down, changing the color, releasing, and again. See from white to dark pink. Silver. Pressing right on the spot of restrictions. Up. Going up. Down, up. Gliding one more time. Nice and mobile tissue here. Base of the big toe. Pressing and releasing. Pressing and releasing. Down and up. And up. Compression towards the midline. See how the muscle is lifted up. Soothing down. Shifting the muscle and the fascia. Up and again and up. Applying the lotion. Just getting more glide. Two. Moving across and diagonal, switching hands, opposite direction, and again switching hands, and across. Parallel. Across. Several parallel motions. Nice change in color of the skin. Soft and warm tissues. Pushing, pressing. Up and down, mid-foot across, down parallel, and again, and the last one, across, diagonal, across, switching hands, and the last position, across, parallel, across, parallel, down, down. And feeling overall for the state of the foot, soft, warm, and relaxed. Checking the arches. How mobile they are. Nicely formed. Soothing the tissues. Getting a bit of lotion. Wrapping them with my hands. Light, soft strokes. Applying more pressure. We have already enough lotion on the foot. First starting with the inner side, medial side of the foot. Moving from the heel. Circular motions on the heel while supporting the ankle. So my thumb and the second finger are on the ankle joint, while my three other fingers moving around the heel towards the ankle, Achilles tendon, and the heel, and up. Up means towards the toes, distal. Feeling the first metatarsal bone, and moving along to the head of the first metatarsal, going back, checking for the first and second row of tarsal bones. Navicular, cuneiform, the base of the metatarsal, and up. Facial restrictions along the plantar surface of first metatarsal. Here we are. Just moving small circles, bigger circle, and moving along. I use some of my tools, volcanic stone hook-like motion, mobilizing the fascia. opposite side. Moving proximal from the toes to the heel. Circular motion. Wide and broad. And applying acupressure right under the navicular bone, spleen, vessel points. Moving along. Release. Press. Release. Okay. Continue with manual treatment in the midfoot. Central line. Adding tiny bit of lotion. Here's imaginary central line. Right. Ends with the mid-toe, the third one, along the third metatarsal, strokes deeper and stronger, feeling for the restrictions in plantar fascia from the heel to the toe. Midfoot restrictions right here, going along the fibers, slow release, slow release, across. Fingers alternating. Compression and distraction. And again. Compression. Distraction. Soothing. Compression. Distraction, compression, distraction, soothing, applying more pressure, stabilizing, stretching, feeling for the first barrier. Tissue resistance, releasing the fascia, using gua sha tool. Moving distal from the heel to toes through the midfoot. Noticing the color changing. More lateral. proximal to distal. Reversing the two, going deeper right through the arch, long arch of the foot, helping to restore the shape, just to tone up the tissue and release fascial restrictions so the arch is flexible and mobile. And double checking. It's way better now. Fascia feels softer, mobile. The bones moving freely. Opposite direction. Compressing, bringing the arch together, releasing and opening it. Compressing, forming the arch, and moving my hands towards the toes. Release. Stabilizing with my left hand. Compression. Using the first toe and the fifth one as my focal points. Flexion in the arch. Compressing. Adding more. Releasing. Soothing the tissue. Applying gentle pressure. Soothing more. Affleurage. Massaging the toes. First spreading with the wooden stick. Supporting with my left hand. All the way from the small toe down along the arch. Fourth one, middle one, second, and the first one. Checking the mobility of the first big toe joint, metatarsophalangeal. Mobilizing, traction, hyperextension and forward flexion, and release, traction, hyperextension, forward flexion, pressure, release. Mobilizing the joint capsule. Phalanges. base and the distal one. Fluorescent. Pressing. Release. Second tool. For the mobilizing the big toe, flexing, extending, gentle valgus and varus, in and out, stretching, release, interdigital space, applying gentle pressure, moving up, second toe, 3 phalanges, working on the base and first proximal interphalangeal joint, gentle traction, middle phalanx, and the distal traction and compression, joint mobilization, gentle hyperextension, traction, release, hyperextension, traction, release. Moving to the third one, interdigital space, getting smaller, applying pressure, proximal phalanx, medial, middle, and the distal one. Compression, tendon, release, gentle traction, relaxing. Next one, compression, gentle traction, mobilization of the proximal interphalangeal joint, middle one, distal, traction, compression, release, last one, interdigital space, compression, traction, spiral compression, mobilization, release. Getting into interdigital space with my acupressure point, activating buffoon points. 1, 2, 3, and the last one. Mobilizing the toes in combination with compression from the acupressure stick, opening up, compressing, releasing. Once again, opening up, interdigital space, compression, release, interdigital space, opening, compression, release, And the last one, with the help of the other hand, compression, deviating the tool, opening up, release. Digital muscle stimulation, plantar surface release, checking the mobility of the fourth and fifth toes. Still can mobilize further. The fourth one, flexing, which means bending, traction, extension, adding hyperextension feeling for the tissue barrier resistance, gentle traction, mobilized, perfect flexion, straight extension, soothing, traditional space, and the fifth one, adduction, flexion, hyperextension, traction, adding more traction, gently hyperextending with the help of the other thumb, traction, release, check, excellent, mobility is restored. For the tissue state, nice and warm, mobile fascia, normal mobility, no restrictions, metatarsal space, head of the metatarsals and toes. To stop, not to think that Captain Chaika. Starting our foot massage, warming up the foot, at the same time assessing state of the skin, temperature, texture, dryness. It's winter, so skin feels more dry than normal. Tissue under the skin, adipose tissue, and then superficial fascia. Adipose tissue is totally normal. Checking for fascial restrictions. Distal from the heel bone, right here. Moving distal, midline, small restriction over the middle cuneiform, moving in the mid-center, the metatarsal towards the middle toe. Again, right here, feel the restricted area. Moving to the medial side, inner side. Fascia is mobile except the base of the phalanx and the head of the first metatarsal. Through the midline, going to the fifth metatarsal bone. Gentle traction, release. Middle of the fifth metatarsal bone, we feel for the restriction. Restriction, which goes all the way from the space between metatarsals and the edge of the fifth metatarsal, right here, hooking it with the finger, remembering where we need to pay the attention, moving up. Checking the toe mobility, one by one. No pulling, just assisting to make the toe straight with the left hand. And checking the big one. Big one is restricted in extension. Slightly restricted flexion in the first metatarsophalangeal joint, and slightly restriction in adduction, adduction. No soreness, no pain, starting with effleurage. Warming up further, whole foot, heel to toes, one by one, right, left, right, left, they meet on top. Now it's left, right, left, right. Moving down together. My hands go up together. 1, 2, 3. Now they start overlapping. 1, 2, 3, 4. So I'm starting on the inner side and end on the outer side, and vice versa, starting on the outer side and moving to the inner side, big toe, repeating that crisscross motion. And moving together. 3. Adding a bit more lotion, moving to the deeper surface, deeper layers. Means we're applying a bit more pressure, starting from the attachment of the Achilles tendon. Just right here on the heel. Circular motion, meeting our fingers here. Going back, forward, back, forward, through the midline, sideways, back to the Achilles. Now applying pressure and moving from the center straight, every stroke closer to the outer inner edge, straight. Now we are off the heel. Moving more central. Two circular strokes. Pressure, release, pressure, release. The inner side. Feeling for the longitudinal arch, long arch of the foot. 1, 2, dorsiflexion, extension, plantar flexion, release, moving lateral outer side, pressing, releasing, pressing, release, press, restrictions along the 5th metatarsal. 1, a bit screechy feeling. 2, 3, using my big gua-sha tool, applying pressure. Patient is reacting. Take a bit to release. Foot is getting pinkish. Applying more lotion. Using gua-sha technique. Gua-sha tool allows me to work on the plantar surface, the transitional zone between the 5th metatarsal bone, skin of the foot, and skin of the upper area. Just changing the angle, moving along. Checking for the restrictions. Soft, mobile tissues. Moving up, which means distal. Pressing on the head of the 5th metatarsal. And now I am on the metatarsal phalangeal joint. Pinky toe, 5th one. Excellent extension, limited flexion, physiological adduction and good abduction. mobilizing the head of the metatarsal. Using my acupressure tool. Apply my acupressure tool, mobilizing the toes and applying pressure to buffoon points. Fourth one. Working on a fourth toe. Again, limited flexion, good extension. Flexing, applying traction, compression. More compression, hyperextending, flexing, more flexion, extension, compression. Double check. Applying pressure to buffoon point 3. Mobilizing. Soothing. And checking the third one. Restricted motion in joint between the phalanx and the head of the metatarsal. Gentle traction first. Flexion, hyperextension, traction, then flexion. Adding the flexion of the interphalangeal joint. Making traction and extension over my tool. Release, pressing in the interdigital space. Buffoon, the point that we used between the toes right a minute ago. Release, compression, traction, compression, and moving along, proximal to distal. Release, rocks. Second toe, very good mobility, contrary to those 2, 3. Move about the dorsophalangeal joint, restricting motion in the first interphalangeal, proximal. Gentle traction, flexion. Again, gentle traction, no hyperextension. Mobility is fully restored. And for the last phalanx, again using my acupressure tool. Traction and flexion without letting it go. And release, traction. Just with the weight of the foot. Release, compression, and applying pressure to the first point of buffoon, buffin in some books. Release. soothing the tissue. And using my tool as the extra hook, volcanic stone tool. Apply gentle pressure, moving up, release, hooking from the other side, adding lotion. Moving up, release, moving up, release, moving up, release, moving up. In that case, up means distal, interdigital space. Hook, pressure, going around, release, pressing base of the toe, feeling for the arch, gentle pull, traction to the heel, now compressing the arch inward towards the sole of the foot, plantar direction, stretch and opening. First we open by hooking to the metatarsal heads of the big and the small toe, releasing. Now we feel for the first, second, fourth, third, middle and fifth, basically all the head of the metatarsal, bringing them into nice arch. This traction and opening. Opening sideways one by one. Except the big toe, which goes opposite direction. Medial, adduction, increasing the space between first and second toes, making it a natural pattern, flexion, extension. Pressing with my acupressure tool. Moving further, pressing again. Once again, and using it to spread the fascia. Nice roll. The tissue manually, good mobility, soft movable muscles and the warm skin. Improved blood supply. Working on the foot using slight position of the plantar flexion to focus more of the plantar tissue. Very easy to feel for any restrictions which remain after the main treatment. For example, here in this area clearly can be felt different from the rest of the foot. Adding tiny bit of lotion and starting not here where we feel it, but from the heel moving towards the restriction. Once we feel it, we change our strokes from the straight, slow moving along. We switch to circular opposite directional movements, keeping our fingers relaxed, applying pressure, but at the same time we are feeling for the changes of the tissues, mobilizing the restriction. Subjectively it feels like the tissue is melting. On the other hand, getting warmer. With the release, the temperature increases. The molecules of proteoglycans get released. Tissue is gliding. The last point is here, closer to fifth metatarsal. Applying pressure, moving, releasing, again, round motion, strokes, smoothing up, proximal, distal, opening, moving back, opening, moving back, opening, moving back. Diagonal light strokes. Gentle medial to lateral movement, heel to the fifth toe, straight back, sideways, straight back, sideways, straight back. We can see the line. Red line shows up. Okay, crossing my fingers and applying pressure, moving them apart, stretching gently, pushing all the blood and intercellular fluid up towards the heel, back to the string. Gentle cross, opposite directional movements. Straight. Down and up. From the toes to fingers. Close. It's just one fingers. Easy to feel the tissue and use gentle strokes with the extra lotion, one directional flourish. No pressure down, light pressure up. Compression. Release. Compression. Release. Gentle compression. Soothing. Working on the plantar surface, checking the tissue for any restrictions which may still be unresolved. Feels smooth. Bit of tissue thickening still in the area between the heel and before the midfoot. Gentle pressure, hooking, pressing, removing, again moving back with my thumb sliding off the heel, moving towards the metatarsal heads, round and coming back, pressing around, coming back, pressing, coming back. Starting from the big toe ray, means that first line. Second, moving towards the thickening, hooking my index and the middle fingers, grabbing, stabilizing with my thumb, gentle pull, pressure, switching to my index finger, applying pressure with the acupressure stick. Releasing. Using my hook-shaped finger, soft mobile tissue, double checking with the thumb, same way, same direction. Excellent. Pink reddish skin, soft, no sign of restriction. Good mobility of the toes. adding extra adduction, varus, and release, sliding back, tiny bit of effleurage, and it motion towards the heel, using my other finger, alternating, pressing, compressing, mobilizing, releasing the joint capsule, applying pressure to the heads of the second, third, fourth, and fifth, applying traction and varus, sliding our thumbs and the index fingers. Excellent. Adding a bit lotion, soothing the tissue nice and smooth. Gentle compression and up on the heel. Compression and movement. Relaxing glide. Gentle compression with just 2 fingers. Pressing the fluid, the lymphatic fluid, intercellular, and the blood from micro vessels. Nice pink coloration of the food. Reacting well to my fingers, changing from white under the pressure to pink and reddish. Pressing around the heel, sliding, coming back, using all my fingers of both hands, including thumbs, covering, releasing, once again, all of them, moving thumbs away, leaving just 2 on each side, just 2 index fingers. Treating the plantar surface of the foot, starting with the slow and light strokes effleurage from the heel to toes, heel to toe and back, and repeat. Straight liner strokes, returning, going sideways, spiral shaped strokes, moving towards the ball of the foot, the base of the 5th toe, pinky. brush. And apply more pressure. Feeling for the tissue hypermobility, the midfoot right here. Slowly continue to tarsal, metatarsal area. Working on the midfoot, feeling for the plantar fascia and the tendon underneath. Slowly checking each ray, 4th, 5th, 3rd, and 2nd. Assessing the first one. And returning. Checking the base of the phalanx. First, 2nd, 3rd, 4th, 5th. Returning. Working precisely around the heel. Attachment of the Achilles tendon. And the tendon sheath of plantar muscles, plantar flexors. Working on the medial side. Semicircular strokes. And the lateral side. Alternating lateral and medial, top of the heel, applying pressure, releasing, pressing again, release, press, release, flourish. Cross movements on the midfoot, pressure, pressing on the lateral side, moving to the midline, slowly transitioning to the medial side. Using my volcanic stone tool, reapplying the lotion and starting from the medial side of the foot. Hooking the first metatarsal bone and releasing. Proximal direction. Applying the pressure. Shaking with my finger. Moving slightly. Clearly feeling fascial restriction. Releasing proximately. Checking with my finger. Applying pressure at the distal area. And releasing. Moving with volcanic stone towards the midline of the foot. Spreading the fascia. The finger. Pressing again. Releasing. Effloration. Grab on the lateral side. Moving it proximal. Effloration. Mobilizing the transverse arch of the foot. Separating the toes. And flexing. And extending. Flexing. Spreading. On the first toe. Flexing, slowly extending. Isolating phalangeal joints. And now we're applying extension in all the joints of the big toe. Flexion, gentle traction. A bit more. Here a little click. And release. Mobilizing second toe. Flexion. Extension. Limited extension. Working on interphalangeal joints. Gentle traction, extension, and applying to all the joints. Similar technique used for the third toe. Flexion, extension, mid-phalangeal joint, lateral mobilization, gentle traction and release. Back to the second tool. Gentle lateral mobilization and release. Checking the fourth toe. A bit shifted medially. Pressing the head of the metatarsal. Extending. Gentle traction. Extending more. Release. Little toe. Supporting head of the metatarsal. Gentle traction. Pressure. Flexion, extension. Lateral mobilization. A bit more traction and release. Working along the fifth metatarsal. Applying firm pressure. Now I'm going to use my acupressure stick. And applying topical pressure, acupressure points. Working around the toe. Pressing on buffoon points. Moving my fingers direction of the toes, bringing together, spreading, together, circular motions, going from lateral to medial, longitudinal arc. Long arch to transverse. 1, 2, 1 more. Parallel and back. Pressing on the medial supinated side. pressure, contour movement of the tissue, pressing again, mobilizing, to release. We'll apply the lotion. Using gua sha tool to work on the whole foot surface. Varying my pressure between the lateral and the medial side. Less pressure on shaking with my fingers. And taking that acupressure stick, moving and applying the pressure. Exploration, pressing, flush, pressure, flush, pressure again. Working on the base of each toe. Same time doing a bit of separation. And the largest, the first toe. Pressing right at the joint line. One by one gets flexor surface treatment. Now using that stick to mobilize each toe precisely. to the next one. Again, supporting the toe with my fingers, using the stick for pressure. Find some rolling over the lateral. Holding the stick, levering. Release. And the big toe, moving the stick. Applying the pressure. Precisely pressing at the base. Separating. Holding the second toe, levering the first one. Changing. Utilizing interphalangeal. A little click, traction, gentle stretch, flourish. Effleurage, gentle stretch, and the last one, effleurage, gentle stretch all along the fifth metatarsal. Broad strokes. Pressure, soothing the tissues. almost no pressure from toes to heel. Soothing motion, warm tissues, pink foot, good blood supply.